Do you feel stiffness or pain in your knees when you try to stand up from a chair or climb stairs? Or perhaps you are tormented by an aching pain in your hip, which is especially strong first thing in the morning immediately after waking up. If this sounds familiar, you are not alone. Many people attribute this to inevitable aging and learn to live with the discomfort. But this condition, known as osteoarthritis, affects millions of people, and it does not have to be a life sentence. Moreover, your natural instinct with such pain is to protect your joints and move less. However, specialists from the Mayo Clinic in their updated recommendations for 2024 warn that for a joint affected by arthritis, the strategy of complete rest might be a mistake. Allow me to explain how experts justify this statement. The physiology of your joint is designed in a unique way. Doctors emphasize that cartilage tissue is avascular. In medicine, this term means that there are absolutely no blood vessels inside the cartilage. Unlike muscles, blood does not deliver nutrition there directly. According to medical data, the only source of nutrition for cartilage is synovial fluid, a special lubricant inside the joint. But as rheumatologists explain this, fluid penetrates into the cartilage only under pressure. When you move, natural compression occurs a squeezing of the joint, which literally presses nutrients into the tissues. If there is no movement, nutrition stops. The cartilage begins to lose strength and break down faster. There is a solution. Today we will look at 6 therapeutic movements that are included in rehabilitation protocols of leading medical centers. These movements are selected to nourish the joint without dangerous loading. We will start with basic recommendations and move to movement number 1. Researchers from Duke University call this movement one of the most effective methods of non-drug treatment. Their reports note that regular performance of this exercise allowed patients to reduce pain levels after just 6 weeks. Before we begin, we would be grateful if you wrote in the comments what city you are from and how old you are. This helps us better understand our geography and prepare materials that will be useful specifically for you. We read all your comments carefully. So let us begin. Movement number 6, lying knee flexion. This exercise is specifically designed to be performed at the very moment when your joints are most vulnerable in the morning, immediately after waking up, even before you get out of bed. Many patients with osteoarthritis make the same mistake. They try to walk it off immediately after sleep. However, rheumatologists from the Johns Hopkins Arthritis Center explain why this can be harmful. During night rest, the circulation of synovial fluid in the joint slows down and its viscosity increases. In simple terms, the lubricant inside the knee becomes thick. If you place full weight load on the joint in such a state, it creates excessive friction on the joint surfaces. The goal of this movement is to safely restore fluid circulation and reduce its viscosity without axial load. The technique is as follows. Remaining lying on your back, fully straighten your legs. Slowly begin to bend one knee, sliding your heel along the surface of the bed towards your buttocks. It is important not to lift your heel from the surface. Bring the leg to a comfortable angle of flexion. You do not need to endure sharp pain, just mild tension is enough. Then just as smoothly, with a sliding movement, straighten the leg back. Specialists recommend performing 10 to 15 repetitions for each leg. This action works like a gentle pump. According to reports from rehabilitation specialists, patients who include this simple movement in their morning routine note a significant reduction in stiffness during the first hours of the day. You have prepared the joint for the load, but now we need to eliminate the reason why the load during walking destroys the knee. And here we move to movement number 5, glute bridge. This exercise aims to solve a hidden problem that is often overlooked when treating osteoarthritis, and this problem can be frightening in its invisibility. The fact is that your knees are often the victims and not the culprits of the pain. In biomechanics, there is a concept of the posterior muscle chain. This is a group of muscles, including the glutes and the back of the thigh, Their main task is to absorb shock load when your foot touches the ground. However, according to research in sports medicine, the majority of people over 55 develop a condition that doctors call gluteal amnesia. Due to a sedentary lifestyle, these muscles atrophy and literally forget how to engage in work. The consequences of this are destructive. When your shock absorber muscles do not work, the shock wave from every step is not dampened. It passes directly through the bone into your knee joint. Imagine thousands of steps a day, and every step is a micro impact on your thinned cartilage. This creates a colossal compression load that accelerates joint wear exponentially. You may not even feel this in the moment, but with every day, the durability reserve of your knee melts away. But there is good news. You can stop this process by returning strength to your natural shock absorbers. The glute bridge is the ideal tool for this task. Its main advantage over squats or lunges lies in the absence of axial load. You strengthen your legs, but do not press with your body weight on the sick joint. The technique is as follows. Lie on your back, bend your knees, place your feet on the floor, hip width apart. Tighten your stomach muscles to stabilize your lower back. On an exhale, press your heels into the floor and smoothly lift your pelvis up. At the top point, pause and consciously squeeze your gluteal muscles with force. You should feel the tension specifically in the glutes and not in the lower back. Then slowly lower yourself down. Specialists from the biomechanics laboratory at Stanford University confirm that strengthening the gluteal muscles allows you to remove up to 40% of the load from the knee joint when walking. This literally means that you're taking a heavy load away from your knees and handing it to the muscles that are created to carry it. Once you have stabilized the pelvis, we need to strengthen the main support of the knee itself. And this leads us to movement number 4. Seated leg extension. This movement is aimed at preventing one of the most frightening scenarios in osteoarthritis. Perhaps you are familiar with the sudden sensation you are simply walking on a flat surface and suddenly your knee spontaneously buckles or gives way as if losing support. Doctors call this instability syndrome. According to statistics published in the Journal of the American Geriatric Society, such instability of the knee joint is the leading cause of accidental falls in people over 60 years old. And we know how catastrophic the consequences of one unlucky fall can be for your mobility and independence. The reason for this instability lies in the atrophy of the quadriceps muscle of the thigh. This is a large muscle on the front surface of the thigh. Its role is to be the main dynamic stabilizer and shock absorber of your knee. When the quadriceps is strong, it takes on the shock load and rigidly fixes the joint in a safe position. But with arthritis, we fall into a trap. Because of pain, we start to spare the leg. The muscle does not receive load and rapidly weakens or atrophies. The knee loses its main protection. The load on the joint itself increases, the pain intensifies, and we spare the leg even more. Movement number 4 breaks this vicious circle. Its uniqueness is that it allows you to isolate and strengthen the quadriceps, eliminating the risk of falling, since it is performed in a sitting position. The technique is as follows. Sit on a chair with a straight back, pressing your feet firmly to the floor. Slowly lift one leg until fully straight at the knee. A critically important moment at the top point. Maximally tighten the muscle on the front of the thigh and hold this tension for 2 to 3 seconds. You should feel the muscle become hard. Then slowly, and I emphasize very slowly, lower the leg. It is this phase of slow lowering that most effectively strengthens muscle fibers. Do not allow sharp swings or momentum. Studies show that restoring quadriceps strength can compensate for structural cartilage damage. Simply put, a strong muscle can work on behalf of a damaged joint, returning confidence to your every step. But to feel confident, not only standing, but also when moving, we need to improve the connection between your brain and your leg. But before we continue, a small request. If the information we are sharing seems useful to you, please help us bring it to other people who might need it just as much. Simply hit the like button. We release new detailed materials twice a week. Be sure to subscribe to the channel so you do not miss anything. And now let us move to movement number 3, standing inner leg lift. This exercise is aimed at restoring a critically important function that osteoarthritis destroys unnoticed but methodically. We are talking about your nervous system. Many patients describe a frightening feeling of disconnection from their body. You put your foot on the ground but do not feel full confidence in the support. The surface seems unstable, and every step on an uneven road causes hidden anxiety. This happens due to a disturbance in proprioception. This is a medical term denoting the ability of your brain to accurately determine the position of body parts in space. In a healthy joint, thousands of nerve receptors send signals to the brain every second. But with chronic inflammation, arthritis literally blinds these sensors. According to research published in the journal Neurology, a deficit in proprioception increases the risk of injury by 50%. Your brain simply does not have time to correct the position of the leg in time, and you lose balance. Movement number 3 is created to reboot this navigation system. It may seem counterintuitive. In gyms, they usually train lifting the outer leg, but to stabilize the joint with arthritis, we need to do the opposite. The technique is as follows. Stand sideways to a wall, leaning slightly on it, with your hand to maintain balance. Slowly lift the inner leg, the one that is closer to the wall, bending it at the knee in front of you. Hold this position. At this moment, a biomechanical miracle occurs. To keep you from falling, the outer side of the thigh of your supporting leg must powerfully engage and work. You will feel a deep, stabilizing tension in the thigh of the leg you're standing on. This is called isometric stabilization. You force deep muscles to hold your body weight, restoring the neural connection between the brain and the joint. Regular practice of this movement returns to you what doctors call joint sense. You start trusting your legs again. The fear of uneven roads goes away, replaced by the confidence of firm support. Now that we have returned stability, we need to solve the problem of pain arising from the friction of bones against each other. And here, movement number 2 enters the stage. Static wall slide. This movement solves an acute dilemma faced by a patient with a diagnosis of stage 3 or 4 osteoarthritis. Doctors tell you that to save the joint, you need to pump up the leg muscles. But when you try to do ordinary squats or lunges, you feel sharp pain. This happens due to mechanical friction. If your cartilage is thinned or destroyed, the joint surfaces begin to touch directly bone on bone. Any dynamic movement, under load in this case, works like sandpaper, intensifying inflammation and swelling. This vicious circle of pain causes many to give up and finally abandon activity. However, research published in the European Journal of Pain offers a solution. Scientists discovered that to strengthen muscles, it is not necessary to move the joint. This is called isometric load. This is a method where the muscle tenses and works at full strength, but the length of the muscle fiber does not change, and the joint remains motionless. No movement means no friction. No friction means no pain. Moreover, researchers found that isometric exercises possess a pronounced analgesic effect. They reduce the sensitivity of nerve endings and reduce inflammation after just a few weeks of practice. Movement number 2 is the safest way to apply this principle. The technique is as follows. Stand with your back to a wall. Place your feet shoulder-width apart, taking a small step forward approximately 40 to 50 centimeters from the wall. Firmly press your shoulder blades and lower back to the surface. Slowly slide your back down, bending your knees. You do not need to go deep. Stop at the point where you feel strong tension in the front of the thigh but do not feel pain in the knees. Freeze in this position. Hold it for 10 to 15 seconds. At this moment, your quadriceps receive a powerful load strengthening the structure around the knee, but inside the joint itself, total peace reigns. The cartilage is not being rubbed, it is protected. This is the ideal compromise, allowing you to become stronger without paying for it with the destruction of the joint. But there is one movement that surpasses even this. It is considered the clinical standard of safety and is available even to those who are currently experiencing acute pain. And this leads us to movement number 1, towel press. Why did we put this simple at first glance movement in first place? Because it is the only exercise on the entire list that doctors permit and even strongly recommend performing during the stage of acute inflammation. When your osteoarthritis flares up, the knee swells and becomes hot. The pain is so piercing that you can neither stand by the wall nor even lift your pelvis. At this moment, many fall into despair, believing that the only thing left for them is to lie down and wait for the painkillers to work. But it is at this moment that a dangerous phenomenon known in medicine as arthrogenic muscle inhibition occurs. This is a protective mechanism because of strong pain. Your brain literally shuts off power to the quadriceps. The muscle stops receiving signals from the nervous system and begins to atrophy, rapidly losing volume and strength. Studies show that in just a few days of inactivity, you can lose a critical volume of muscle mass, which will then have to be restored for months. Movement number 1 is created specifically to hack this mechanism. It allows you to safely contract the muscle and send a signal to the brain saying the muscle is alive, it is working, while the load on the inflamed joint itself is 0. Let us break down the technique. Sit on the bed or on the floor, stretching your legs out in front of you. Take an ordinary towel and roll it into a tight cylinder. Place this roll directly under your knee. Now your task is to tighten the thigh muscle and forcefully press the back of the knee onto the towel, trying to flatten it against the floor. Your heel may lift slightly off the surface during this. Hold this maximum tension for 10 seconds, then relax. You will feel the quadriceps working, but inside the knee there will be no movement or friction. The towel acts as a soft shock absorber protecting the joint. The effectiveness of this method is confirmed clinically. In a study conducted by specialists at Duke University in 2021, a group of patients with severe osteoarthritis followed this protocol daily. The results amazed the doctors after 6 weeks. Participants showed an improvement in mobility of 40% and a significant reduction in the need for medication-based pain relief. This movement is your foundation. It is where the path from the inability to get out of bed to a confident walk in the park begins. Ultimately, the revolution in understanding osteoarthritis lies in changing your mindset. For years, we were told that pain in the joints is a stop signal, but modern science and the experience of thousands of patients prove the opposite. For your cartilage, correct movement is the only source of life. These 6 movements are a tool that allows you to take control of the aging process. With every conscious bending of the knee, with every tensing of the muscle, you literally feed your joints and build protection against falls. The choice is yours. You can start today right in bed with movement number 6, and step by step return confidence to your every movement. Now we want to hear from you. Which of the movements we talked about today seemed most interesting to you, and which one would you like to try first? Share your opinion in the comments below. We read all your answers. Thank you for your time and trust. Be healthy.